know that feeling? You try and lift something, you feel all that pressure go through your lower back, or maybe you've lifted something wrong before and it's had you laid up for a week or two with severe back pain. Well, it's a common problem we see in our office, and if that's you or someone you love, stick around because in this video, I'm going to show you the proper lifting techniques so you can protect your back, whether it's something big and heavy or even something small and light, so that you can keep active, keep moving, and stay healthy. Hi, I'm Dr. Scott McCrimmon, a chiropractor here at Caledonies Family Chiropractic. Our YouTube channel is devoted towards giving you and your family the latest, most up-to-date health information to keep you active, keep you healthy, and keep you living the life that you want to live. If you find the information in these videos helpful, please feel free to give them a like and even subscribe to our channel as we put out the latest information each week to keep you healthy and moving well. Okay, low back pain with lifting. One of the more common things that we see in our office, and for some people it can be really debilitating, laying them up for weeks at a time. Before I get into showing you the actual different lifting techniques, we need to understand a little bit about how our spine works, because once you understand how it works, then you'll understand why we're teaching you to lift the way we do, and you'll be able to adapt that to any situation or anything that you need to lift. The first thing we need to understand are the mechanics of our spine. When you look at a spine from the side, we should have three curves: the neck curve, the mid-back curve, and the lower back curve. For this video, we're focused on the lower back because that's often most injured when we're lifting. So when you look at the lower back from the side, we should have 5 vertebrae, 1, 2, 3, 4, 5, with this nice curve towards the front. So if you look at me from the side, it should look like this with the curve going towards your stomach. That curve is really important because it protects the vital structures in our spine. So when we look at our low back or our lumbar spine, we should see 5 vertebrae, 1, 2, 3, 4, and 5, as well as our sacrum, which is this big flat bone at the bottom. In between each of the vertebrae, we have our discs, which we're going to talk about a little bit more in detail in a second, as well we have our spinal nerves that come out of our spine, and they're really important. They are how our brain communicates with our body. It's what keeps us healthy, and it coordinates all the functions throughout our entire body. And the nerves from our lower back, they have a lot to do with stuff in your abdomen, as well as everything basically from the waist down. Now, when we maintain this nice curve or lordosis, the stress is where it's supposed to be, back on the joints at the back. So if you see when I squish down on the spine, right, the stress is back at the joints. As soon as we start to lose that curve and we bend things forward, you can see how this opens everything up at the back, but it also starts to put a lot of pressure on the discs at the front. And as I love to say, discs are like ice cream sandwiches. You put pressure on one side, the ice cream is going to squish out the other side. And this is the model I like to use to explain that to patients. It's not as drastic as this, but if you see when I squeeze towards the front of this vertebrae, you can see how there's material that bulges out the back, and that can actually put pressure on a nerve, or in and of itself can create a lot of pain and discomfort. So I'll show you again, if we bend with improper posture and put pressure on the front of the disc, you can see how things start to bulge out the back. And that is something we definitely want to avoid. So our focus anytime we have to bend or lift is to maintain this normal curve in our back. And there are definitely ways we can do that. If we bend improperly, we get this situation happening, and it's a very weak position for our low back, and it's an injury waiting to happen. Okay, so how does that relate to real life bending and lifting? Let me show you. If I stand here with reasonably good posture, I'm going to have that nice curve or lordosis in my lower back. Now, I'm going to show you 2 different ways of bending to lift up this box. The first one is what we see often is legs straight, and I start to bend, and as you can see, my back is rounded. And what that is, if you look at our friend here, we have this nice curve in our lower back, and then as we start to bend forward, we're getting this rounding through our lower back, which is that very weak position that's very prone to injury. Now, the second way I'm going to bend and lift this is I'm going to keep that curve in my back, and instead of the bending coming through my lower back, it's going to come through my hips. So I have this curve in my lower back, and as I bend, this curve stays. You can see I'm hinging through the hips, but I'm not getting this rounding through my back. I'm maintaining that curve, and I can bend and pick that up much easier. One way I like to relate this to patients is Olympic weightlifting. If you've ever watched at the Olympics or seen it on YouTube or a video, you'll notice they never just reach down, bent over, head down, and lift the weight up like this. A couple things they always do. They lock their abs or their core nice and tight. They stick their bum out a little bit because that locks that lordosis in their lower back. They bend at the hip, and before they lift, their eyes are always up, and they lift with a good strong back. If you haven't seen it, go look up a couple videos of it, you'll see exactly what I'm talking about. So now I'm going to go through and show you a couple different ways of lifting that maintain that proper curve in our back, We're gonna start with some heavy things, how you pick up a big heavy box, or if you have to help somebody move something big and strong, or also how you lift up something small and light. Now you might be thinking, why do I need to learn how to lift up something small? It's not heavy, it's not gonna hurt my back. Well, let me tell you, some of the worst back injuries I've seen in my office, where you think someone had fallen down the stairs or been hit by a car, when I ask the patient, what did you do? It's, I bent over to pick up a pencil, or I dropped my glasses and I went to pick them up. And that was actually the worst back pain that they've had, and often some of the worst ones I see in my office. Because often when we lift something heavy, we think about these things, when this is heavy, I might hurt my back. But when it's something small and light, we don't often think, and we just go, and that's when we hurt our back. So I'm gonna show you some tips for lifting light things as well. Okay, so let's start with this box that we had at the beginning of our video. It actually has a little bit of weight to it because it is full of paper. So, and a lot of people have to lift boxes or small cases or things like that throughout the day. So let's start there. First thing is, whenever we have to lift something that's a reasonable size that we can manage, what we want is the closer the weight can be to our body, the better. The further away it is, it creates what we call a lever arm, which is going to create more force pulling you forward, which will put more stress on your back. So number one, close to your body. Number two, you want to keep it as close to your midline as you can. You don't want to have to be reaching to the side or have it outside your center of gravity. So we always say between our knees and close to our body is number one. Now, next thing we want to do is we want to protect our back. So as we said, we're going to keep that curve locked in our back, hinge or bend in our hips, and always a little bend in our knees. If you are lifting with straight legs, you are going to at some point put stress to your back because most of our hamstrings are way too tight, and our bending will come through our back and not through our hips and lengthening our hamstrings. So I have our weight nice and close to my body. It's right between my knees. I'm going to bend my knees, grab the weight the best I can grip it. The next key is your eyes. If you're looking down when you go to lift, that is going to be mostly through my back. As soon as I grab my weight, right where I want it, between my knees, close to my body, before I lift my head up. As soon as I lift my head up, that's going to protect my back, and I can lift that, and all that stress is coming through my legs. So I'm going to show you that again, just from a front view. So again, we have the weight as close to our body as we can, in between our knees. Again, you never want to have this over here and be twisting and bending to lift that. There's a triad in the low back literature. It's called bending, lifting, twisting. You put those three together, so you bend, you lift, and you twist. That's really weak for your back, and that's definitely an injury that's going to happen. So we keep our box right between our knees, nice and close to our body. Lock that curve in our back, little bend in our knees. I'm going to bend down to pick up my weight by bending my knees and my hips. And just before I lift, I'm going to lift my head up, which shifts the weight to my legs. And I can lift that up all day. Or at least until my legs get tired from all the squats. Now, that's just straight lifting, which if you can do that, it's a nice neutral posture. Everything's going to be good. Where people often run into trouble is when they need to move our box from one spot and put it somewhere else. So for example, if I need to take this box and it's got to go up on the table, this is that bending, lifting, twisting we're talking about. What most people do is they bend, again, legs straight, grab like this, and they just throw it over to the side like that. It's going to be fine a lot of times, but when that goes bad, it's going to be a big problem. Because again, that's our bending, our lifting, and our twisting. Really weak for our back, and definitely an injury waiting to happen. So what do we do? If I have to get this box from the floor to this table without putting a ton of stress on my back, we're going to go through our steps again. Box close to our body, between our knees. I bend my knees, hinge at the hips, keep that lordosis in my back. My eyes come up, I lift, and as soon as I'm up, instead of just throwing this to the side, one little step, bend my knees, it's on the table, and I've put no stress through my back at all. So I'll show you one more time. From here. So, bend, keep that nice curve in my back, eyes up, lift with my legs, quick turn, get to the table, drop. Maybe it's one extra step than you have to, but again, it's when we're in a rush and we do things without thinking, that's when your back's gonna hurt. Okay, so what if we have to lift something really big and heavy like this treadmill? Okay, hopefully you don't have to do this too often, but I used to work for a moving company in my younger days, and I saw all kinds of back injuries and some horrible lifting postures, usually because it's in a rush, they're big and heavy, trying to get things done without planning things out first. But I'm just gonna show you a couple things that I'd often see. So when you have something big like this, number one, have help. Never try and do something like this on your own. But I'm gonna show you two different ways to lift. So number one, which I often see, is people say, okay, I have to bend my knees. They get nice and low like this so they can grip onto the treadmill, and then they go to lift. The legs come up, the head comes down, and it's a lift and a pull. So again, look at my back, how rounded that is, and I can even feel stress through my back just doing that alone. So that's definitely a no. If it's big and heavy, you've got your help, you have everything set out. Bending the knees is a great way to start. A little wider feet is helpful. Now obviously you can't have this whole weight between your knees and super close to your body, but as close as you can get it. Grab with a nice comfortable grip, but before you lift, eyes up. Your eyes are always the key. If you get your eyes up and now I lift, you can see how my back is staying straight and all that stress is coming through the knees. I can lift up a little bit with no strain on my back at all. Okay? Really important, don't bend your back. Use your legs, keep that good curve in your back as best as you can, but your eyes up will really help you maintain that. So the difference between eyes down and eyes up. Okay? Okay, so the last thing that I want to talk about today is how to lift something small and light. Like you've dropped your keys, you've dropped your phone. Sounds silly, we just bend over and pick them up and go on. But as I mentioned earlier, some of the worst back injuries that I've seen in our office, or at least the patients in the most amount of pain, are people who have bent over and picked up something small and easy. I'll never forget, I had a lady years ago whose husband actually physically carried her into our office, put her on my table, and when I asked her what happened, expecting some big trauma or some big accident, she said, I bent over to pick up a pencil. And that lady, she couldn't even stand, she was in so much pain. So, even silly little movements, or seemingly silly movements like that, can put us in a world of hurt if we do things incorrectly. So, I've got a napkin here, I've got that little spine mop. If I happen to drop them on the ground, which if you know me, I drop things often, most of the time we're not going to think, we're just going to go like this. Again, I've got that rounded back, we'll grab it, I'll probably twist and go on my way to get going. Most of the time it's going to work out fine, but again, it can go wrong really quickly. So a couple small little pointers. You can very easily do what we've talked about before, where we keep that curve in our back, bend our knees to lift it up. Okay, that you can do, no problem. It seems like a lot of effort though, sometimes just to pick up something small and light, especially for those who don't like to do squats. So the way we teach people, if you have to get something small and light, is what we call a golfer's lift. So for those who like golf and watch it on TV, you'll never see a golfer sink a putt, go over the hole, and do this. Right? If you know how they get a golf ball out of a hole, they do something called a golfer's lift, where they put one leg out the back, like this, and they bend over and pick it up. By getting 1 foot off the ground, you actually take the stress off of your back, and you'll maintain that curvature lordosis without putting that rounding in there. So again, if this is on the floor, you can be either leg, put one leg out the back, bend over, pick it up, my back's totally safe and it will be fine. Now, for those who struggle with balance, obviously we don't want you to fall and hurt yourself, so if you have something, depending on where it is nearby, a chair or a table, for example, I have this cabinet, I can lean on the cabinet, put 1 foot out, like a golfer would lean on their putter, that will make it even easier. So if you don't have something to lean on, your balance isn't good, then just do this. Like we talked about, that will definitely help out because we don't want you to, as we said, to fall over and hurt yourself. So I hope you find that helpful, and just remember the key things when it comes to lifting. You want to maintain that proper curve or lordosis in your back. You want to bend through the hips. To do that, you must put a bend in your knees, okay? So you're gonna stick your bum out a little bit, maintain that curve in our back, hinge to our hips, and then before we lift, our eyes are always up, and we push through our legs, okay? If it's something small and light, we can do that golfer's lift where one leg comes out the back, and we can lift things up nice and easy. Again, whatever you have to lift, especially if it's something big, remember to plan it out, think about how you're gonna lift it. The more you practice these techniques, the more they will become natural to you. You won't have to think about it. Remember, also, close to your body and between your knees. So right in your midline, as close to your body as you can, will minimize the stress on your back as well. Well, I certainly hope you found that information helpful, help protect your back, allow you to be active and do all the lifting that you need to do. If you have any questions or comments, please leave them in the comments below. If you'd like to see any future videos from any of the practitioners in our office, put them in the comments and we'll do our best to create a video that can help you answer any of your health-related questions. Until next time, have an awesome day.